Have you ever wondered what your breath is secretly trying to tell you? Believe it or not, your breath isn't just about how fresh or stinky it is after lunch. It can actually reveal surprising things about your overall health. Hi, my name is Bilal, and you're watching Mr. Teeth. I'm a dental professional, and today we're going to dive deep into the world of bad breath, also known as halitosis or oral malodor. Most people think bad breath only happens because you ate garlic, onions, or maybe skipped brushing one night. But the truth is much bigger. Your breath can reflect what's happening inside your mouth and your entire body. So if you've ever struggled with bad breath or you're worried about what it might mean for your health, stay tuned. This video is for you. Face, what exactly is bad breath? Let's start simple. Bad breath, or halitosis, is an unpleasant odor coming from the mouth. Sounds obvious, right? But here's the thing. It's not always easy to figure out the cause. Sometimes it's temporary, like after eating spicy food. Other times, it's chronic, meaning it lingers no matter what you do. Temporary bad breath usually goes away with brushing, rinsing, or chewing gum. But chronic bad breath is a sign that something deeper is going on. And that's where most people get confused. They keep using mouthwash or mints, thinking they're fixing the problem, when in reality, they're just masking it. Here's the fact. 9 out of 10 cases of chronic bad breath are caused by problems inside the mouth, bacteria, gum disease, or poor oral hygiene. But that remaining 1 out of 10 can be linked to serious health conditions, and that's why you should never ignore it. Bacterial buildup. So let's break it down. The number one cause of bad breath is bacterial buildup in your mouth. When you don't brush or floss properly, food particles stay trapped between your teeth and on your tongue. These tiny leftovers become a buffet for bacteria. And here's what happens. Those bacteria feed on the debris and release sulfur compounds, gases that smell like rotten eggs. That's why your morning breath can be so unpleasant. Your mouth dries out overnight, bacteria multiply, and the odor builds up. Now, if brushing, flossing, and tongue cleaning don't fix it, chances are you're dealing with something more serious, like gum disease. Gum disease and bad breath connection gum disease, or periodontal disease, starts quietly. At first, it looks like mild redness or bleeding when you brush. That's called gingivitis, the earliest stage. But if plaque on your teeth isn't cleaned off properly, it hardens into tartar, a rock-like substance that brushing and flossing at home cannot remove. Once tartar builds up, it creates pockets around your teeth where bacteria hide and thrive. These bacteria cause infection and inflammation of the gums, leading to chronic bad breath. Here's the scary part. Plaque can harden into tartar in as little as 24 to 48 hours. That means skipping even one night of brushing or flossing can start the process of tartar formation. And once tartar is there, the only safe way to remove it is with a professional dental cleaning. So, if you've been brushing and flossing but your breath still stinks, chances are tartar has formed below your gum line, and that's a clear sign of gum disease. Adult medical symbol wide dental cleanings are essential. I know a lot of people think, I brush every day. Why do I need a dentist to clean my teeth? Well, here's why. Brushing and flossing remove soft plaque, but they cannot remove hardened tartar. If tartar is left untreated, it irritates your gums, leading to periodontitis, advanced gum disease. Periodontitis doesn't just cause bad breath. It destroys gum tissue, damages bone, and can eventually make your teeth loose or even fall out. When you visit your dentist or dental hygienist, they perform scaling, a process that carefully removes tartar from both above and below the gum line. If your gum disease is more advanced, you may even need a deep cleaning, also known as scaling and root planing. And here's the key. Once your teeth are professionally cleaned, you still have to maintain them at home. Brushing, flossing, and tongue scraping every single day are what keep plaque from turning back into tartar. Tooth home care. Your first line of defense here are your daily must dose. 1. Brush twice a day. Gentle circular motions. Focus on gum line. Point 2. Floss once a day. Removes plaque between teeth where brushes can't reach. Point 3. Scrape your tongue. A tongue scraper removes odor-causing bacteria. Point 4. Stay hydrated. Saliva is your body's natural defense. Point 5. Routine checkups. Even with perfect home care, professional cleanings are non-negotiable. Light bulb quick fact. Studies show people who floss regularly actually lower their risk of stroke. That's because gum health is directly connected to your heart and blood vessels. Brain systemic health connections. When bad breath means something more, your gums are directly connected to your bloodstream. The bacteria that cause gum disease don't just stay in your mouth. They can travel throughout your body. Heart disease and stroke. Gum bacteria found in arteries, increasing heart risk. Diabetes. Gum inflammation disrupts blood sugar control. Kidney disease. Chronic gum infections strain kidneys that Alzheimer's disease. Gum bacteria discovered in patient brains. Pregnancy complications. Gum disease linked to premature births. So, persistent bad breath could be a medical warning sign. Non-oral causes of bad breath. If dental causes are ruled out, bad breath may come from tonsil stones, smelly stones in the throat. Postnasal drip, mucus-feeding bacteria, acid reflux, GERD, sour/metallic odor from stomach acid, respiratory infections, bronchitis, pneumonia, liver/kidney disease. Breath changes can indicate organ issues. Hot beverage, everyday habits that cause bad breath. Coffee and alcohol, dry the mouth, smoking and vaping. Increase gum disease risk. Skipping breakfast, morning odor lingers. High-protein diets, more sulfur gases, dehydration, saliva drops, bacteria thrive. Receipt. Myths versus fact about bad breath. Crossmark, mouthwash cures bad breath. White heavy checkmark, only masks smell temporarily. Crossmark, brushing is enough. White heavy checkmark, flossing cleans where brushes can't. Crossmark, only food causes bad breath. White heavy checkmark, bacteria and disease are main causes. Crossmark, scaling damages teeth. White heavy checkmark, scaling saves teeth by removing tartar. Test tube, diagnosing the real cause. 1. Self-check, lick wrist, let dry, smell. Point 2. Dental exam, ask about gums and tartar. Point 3. Tongue check, white/yellow coating equals odor source. Point 4. Medical exam, rule out reflux, sinus, systemic issues. Hammer and wrench, step-by-step solutions. Brush twice daily with fluoride toothpaste. Floss daily or use interdental cleaners. Scrape tongue every morning. Stay hydrated. Choose sugar-free gum. Use alcohol-free rinses. Avoid smoking, excess coffee/alcohol. Eat crunchy fruits and veggies. Tooth advanced dental treatment, scaling and root planing. Deep cleaning for gum pockets. Antibiotic therapy. Medicated gels/rinses. Surgery for severe gum disease. Police scarlight when bad breath is a warning sign. Persistent bad breath may indicate progressing gum disease, uncontrolled diabetes, heart problems, liver/kidney issues, early Alzheimer's. Links. Directed practical tips to stay fresh. Brush after strong-smelling meals. Carry sugar-free gum or a travel brush. Replace toothbrush every 3 months. Clean tongue daily. See dentist twice yearly. Key bad breath is usually bacterial. Gum disease is a top culprit. Only professional cleaning removes tartar. Oral health connects to whole body health. Non-oral causes exist. Reflux, sinus, systemic illness. Daily home care plus routine dental visits equal success. Your breath isn't just about smelling fresh. It's a reflection of your overall health. If you notice persistent bad breath, don't ignore it. Start with your dentist, and if the issue continues, check with your doctor. Healthier gums mean a healthier you. If this video helped you, please like, subscribe, and hit the notification bell so you never miss an update from Mr. Teeth. Share this with a friend who might be struggling. You might help them uncover something life-changing. Thanks for watching, and remember, take care of your teeth, and they'll take care of you.